We present the arthroscopic knotless double bundle inferior glenohumeral ligament reconstruction for static inferior shoulder subluxation. The patient is positioned in lateral decubitus for shoulder arthroscopy with a posterior obliquity of 40 degrees. The arm is elevated at 30 degrees angle in neutral rotation and under 3 kilograms of traction. A standard posterior portal and anterior working portal are created. The anterosupralateral view portal is made posterior to the bicep tendon. The tie-rope ACL specific guide is introduced through the posterior portal and positioned at 6 o'clock on the humeral side. The other arm is then placed on the lateral aspect of the humerus percutaneously. The correct position of the guide is verified using intraoperative fluoroscopy. A 3.5 mm humeral tunnel is created using the flip cutter of Artrex. Once the drill tip is visible during arthroscopy, the diameter is changed to 7 mm. And a 25 mm long tunnel is created using a retro drill. The flip cutter must be readjusted to a 3.5 diameter to allow the drill to be removed, resulting in a blinded humeral tunnel. Next, a fiber stick carrying a suture transport is passed through the tunnel, which will then be retrieved through the anterior portal. The graft length is measured using the suture transport and the suture retriever at the 2-3 o'clock anterior glenoid and the exit of the interarticular humeral tunnel. A semitendinous allograft with a final desired length is typically 10 or 12 mm long. To prepare the graft, 2 fiber loops are passed through both ends using a Krakow suture with 2 cm of each end, leaving 2 fiber wire tails. The tie-rope device is transported through the humeral tunnel using the suture transport retrieved from the joint through the anterior portal. The bottom is then placed on the lateral cortex of the great tuberosity just at the exit of the drill hole. The graft is passed through the tie-rope loop at the midpoint of the graft. The traction sutures are pulled through the lateral humeral cortex. Then, the allograft is inserted through the anterior portal into the entrance of the humeral tunnel at 6 o'clock, achieving partial fixation. Both limbs of the graft are separate. One is moved to the posterior and the other is kept in the anterior portal. Both sutures are fixed to the glenoid rim using a knotless 2.9 mm push lock anchors at 3 o'clock. The same step is repeated to fix the graft at 9 o'clock position. Additional fixation is performed at 4 o'clock position using a knotless fiber tack 1.8 mm anchors, with the suture repair passing around the graft. The same technique is repeated at 8 o'clock, achieving a stable fixation of the graft. Finally, the graft is adjusted by pulling the tie-rope device to ensure the IGLHL knotless double bundle is